Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, August the 31st. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tuesday, tomorrow, and Wednesday at 3 o'clock, Dr. Henry and I will be providing a written briefing with case counts and other relevant information with respect to COVID-19. On Thursday in Vancouver, Dr. Henry and I will be presenting or giving a briefing about COVID-19 in BC. That briefing will include some updates to some of the modeling that has been done and other presentations and information relative to the pandemic in British Columbia from Dr. Henry, so you can expect that on Thursday. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. I'd like to start by recognizing that today is International Overdose Awareness Day, and our thoughts go out to the families and friends and communities of the many people that we have tragically lost here in British Columbia and across the country to the overdose crises that we are also dealing with here in this province. Today we are reporting as well on the COVID-19 for 3 reporting periods. From Friday to Saturday, we had 86 new cases diagnosed. From Saturday to Sunday, 107 new cases. And from Sunday to today, 101 new cases, bringing our total to 294 new people diagnosed with COVID-19, including 3 epidemiologically linked cases over the last weekend. That brings our total here in British Columbia to 5,790 people. That includes 1,900 people in the Vancouver Coastal Health Region, 3,042 people in the Fraser Health Region, 175 people in the Vancouver Island Health Region, 440 people in the Interior Health Region, and 154 people in Northern Health Region. 79 of our cases have been people who reside outside of Canada. We currently have just over 1,107 active cases in the province in all of our health authorities, of whom we have 28 people now in hospital, 10 of whom are in critical care or ICU. In the past weekend, we have had 4 new people who have died from COVID-19, 3 of whom were residents of long-term care. And our condolences go out to the families, to the friends, and to the care providers for these people. We have 2,723 people now under active public health monitoring because they have been a close contact of a case. And we're now up to 4,406 people who have recovered from COVID-19. In terms of outbreaks, we have 1 new healthcare outbreak in the Normanna Long-Term Care Home in Fraser Health, where we have a single healthcare worker identified with that. And we have 2 outbreaks that have been declared over. One is the Dania Home outbreak in Fraser Health, and the other, thankfully, is the Holy Family Hospital outbreak in Vancouver Coastal Health, which was, as we know, a very challenging outbreak. And we are all very relieved that this has been brought under control. There are 10 active outbreaks in our health system, 8 in long-term care and assisted living, and 2 in acute care. And we're now up to 725 cases associated with those, 440 residents and 285 staff. We have no new community outbreaks, although we do have a community alert for the Presbyterian region that Northern Health has put out with a number of cases associated with events that have happened in the month of August. So anyone who attended events, gatherings, or ceremonies during this period is asked to monitor themselves closely for symptoms and to contact public health. We have testing available rapidly in the area for anyone should symptoms develop. On a positive note, the Kelowna area cluster that started after the long weekend in July has now been officially declared over, as we've had no new cases associated with that over the last few weeks. On Friday as well, we announced that the Haida Gwaii outbreak has also been declared over, and it really is the communities coming together and working together to manage these clusters